right, guys, welcome back to our provider spotlight. I'm Dr. Wong with Next Level Physiotherapy. I have a special guest with me today, Dr. Brackney with Spine and Sports Therapy in Kingwood, Texas. Welcome to the show, Dr. Brackney.
Hey, Dr. Wong, thanks for having me.
Yeah, for sure. So you're one of the very few rehab chiropractors in the community. Obviously, you're very unique in what you do. So I just have a couple of questions I want to ask you today for our viewers. And then at the very end, if they want more information, they can contact you. Okay. So I guess my first question is, how'd you get into chiropractic in the first place?
It's a good question. I actually was never interested in chiropractic when I was thinking about, career options, but I always loved sports medicine. So I actually started out as an athletic trainer. Okay. So I did that in undergrad, and once I graduated, I got licensed here in Texas. And I worked actually at Rice University for a few years as an athletic trainer. So worked with, several of the teams there at Rice, swimming, tennis, football a bit, track a bit. And it was great. I loved it. And that was always my passion, is sports medicine. But very long story short, Spine and Sports Therapy, the clinic I'm a part of now, provides the sports chiropractors for Rice Athletics. So I kind of rubbed elbows with those rehab chiros there at Rice, and they're the ones that kind of inspired me to want to pursue this subspecialty within sports medicine. So yeah, that's how I got to where I am now.
Okay. So you mentioned the term rehab chiros, right? There's different, obviously, chiropractors out there. What is the difference between a rehab chiro and what most of people know as like a traditional chiropractor? What do you guys do that's different?
Yeah, I think there's quite a few differences between what I would consider traditional chiropractic, which is what most people are familiar with. You go in, you get your back popped, your neck popped, and then you're done. What rehab chiros focus more on is the whole body, not just the spine, but really the whole body. And also they utilize a lot more therapy techniques than just popping the back, do muscle therapy, do therapeutic exercise, and really trying to find what's the root cause of the patient's injury or pain. Not just like, all right, that hurts, pop it, but like, why does it hurt? What's leading to that pain issue or that injury? So those are some of the main things that kind of would differentiate like a rehab specialty chiro versus a traditional chiropractor.
Gotcha. Do you see more in your field, which I don't know about, do you see more of the traditional chiropractors going into rehab chiros nowadays because it's more of a holistic way of treating?
It's getting more and more common. Even probably, 20 years ago, there were very few rehab chiros around. Mm-hmm. But as over the past 20 years, it's really gone up. And so the young docs that are getting into chiropractic college, a lot of them are pursuing more of this rehab focus, which I think is a good thing overall.
Right, for sure. Definitely. Yeah. Okay, awesome. So who is your ideal patient as a rehab chiro?
So a lot of some of my ideal clients are people who live active lifestyles. So whether they're marathon runners or power lifters or people that do jiu-jitsu, for example, those are some of the ideal clients, because invariably they're always end up hurting themselves. They're training for some type of competition or at least some higher level of training that they're trying to attain. And with that level of training, usually people tend to get aches, pains, injuries, and sometimes injuries. And that's where I can come in and help them achieve those fitness life activity goals. So.
Yeah, it totally makes sense. And what does the process look like to work with you?
It's pretty easy. We set up an initial evaluation, and then we spend a little bit more time on that first visit just to do a more thorough evaluation. So we look at whatever, say they have knee pain, for example. I'm going to look at their knee and do all the standard, what you'd consider, orthopedic tests and range of motion assessments and manual muscle tests and stuff. But what I also do, which is I know what you do as well, is look at the whole body and how the whole system is working. So they have knee pain, but is it really a knee problem or is it a hip problem? Because their glute medius is weak, their glute max is weak, and it's leading to a valgus stress, and then they're getting a knee pain, whatever it is. So looking at the entire the body as a system, and not just honing in on the one area that they're complaining about. So we spend a good 30 to 45 minutes doing an evaluation, and then from there, that allows us to have a more appropriate treatment plan. Like once you understand how everything's contributing to the issue, your treatment plan is more targeted, and you tend to get better outcomes when you're really treating the underlying root cause issue. So,
yeah, that totally makes sense. Yeah, there's like about 60-70% people we see that have knee pain is actually not coming from the knee.
Yeah.
It's just like, oh, but my knee hurts. Yeah, but it could be come from your ankle that's all over the place, or your hip is all over the place, and now your knee's taking the blunt of all the forces, right? So I totally cannot resonate with you. It's why, like, hey, yes, I understand your knee hurts, but really we got to check the whole system to see how everything moves together, right?
Yeah.
Which is why I really enjoy, like you said, the holistic model where you're looking at the whole body versus just like microscopic into like what bothers them. So that's cool.
Yeah.
So after initial evaluation, what does a typical session look like?
So depending on the severity of the issue, we'll either set up 30-minute follow-up sessions or 60-minute follow-up sessions.
Okay.
But it's usually I usually set up at about 2 to 3 sessions after that first one, as a trial, a trial run. Like, are we making a difference? Are you getting better function? Are you having less pain? Are we getting back to the activities that you weren't able to do? And that's what for that first 2 to 3 sessions after the first one are designed to answer. We're designed to answer those questions. If we are, then from there we say, all right, next you need to start strengthening. You start strengthening hips, core, whatever it is. And we kind of create an additional game plan, but usually it's more on their own at that point. Like I kind of guide them on what their next steps should be after that. Or if it's like, well, we got a little bit better, but still hurting, let's do another couple sessions to try to reach that maximum therapeutic benefit. So that's in a nutshell what most kind of treatment plans look like.
Okay, awesome. And for the viewers, how do they know if they need, your attention on Rehab Chiro versus like a traditional chiropractic care?
It's a great question. I think for one, and this is really common, they've tried a regular chiropractor and it hasn't really helped. It's like, yeah, it kind of feels good for a little bit, but then my issue comes right back later that day or the next day. Well, that's a sign that they didn't really address the root cause issue, but kind of just in general, it's really common if, joints pop all the time, right? We get out of bed, we move around, they pop. But if something's new or different or painful with joint popping, that could be a sign that a joint is pretty dysfunctional and needs some decompression type therapy or, a joint mobilization manipulation. So those are some of the basic things.
Okay. No, that's good. Good analogy, because we have a lot of patients here who've been to a chiropractor, and some are like, oh, we love it. Some of them like, oh, it kind of hurt me. So they're kind of scared of going back into chiropractic care. And a lot of things that we do is educate, right? So, obviously we'll tell them like, hey, just like you could go to a doctor and maybe you got the medications that was way too strong and it did more harm than good, but then you don't just give up on doctors, right? So why would you just give up on chiropractic care just because you have one bad experience when there's other chiropractors out there who are, different, like a Rehab Chiro, right? Yeah. So I definitely can resonate with what you just mentioned.
Yep. When I was a kid, my parents used to go to a traditional chiropractor, and every once in a while they'd bring me, and man, he was a large human being, and he would just really lay into people. And so I was like, oh, I do not want to go see this guy, because it's like he puts so much force. And I think sometimes that's needed, but I think the key is you have to tailor your treatment to the individual.
For sure.
If it's someone that's really delicate in nature and gentle, smaller tissue mass, then you have to have a lighter touch. If someone's a really big human being, like a linebacker or something, then you have to use a heavier hand. So to me, the best approach is, tailoring your treatment style to the person, what they need.
Right. No, you bring up a really good point. And the patients that we share, they always, vouch for you of how custom your care is, and how much they really appreciate that kind of method and stuff like that. So that's awesome. My next question is, what's something that most people don't know about rehab chiros that they should know before seeing a rehab chiro?
That's a good question. One of the things that I think is important is just being ready for a longer treatment time. Most people like that, but a longer evaluation time and a longer treatment time. Most traditional chiropractic, you're kind of in and out in maybe 5-10 minutes. But usually in the rehab chiro setting, you're spending a longer amount of time with each other doing the treatments. So that, but again, most people appreciate that. But if people are used to coming in, coming out, they may be like, wow, that appointment was too long. But like I said, most people I've encountered actually appreciate that because they feel like they're getting their issue addressed. They feel like they're being listened to and heard,
Yeah, it totally makes sense. One of the biggest complaints we get from a lot of our patients when they come from a doctor's office, especially a busy one, is that they might have to wait a month or two to get in to see the doctor. But once they get in, the doctor sees them for like 5-10 minutes and then they're nowhere to be found, right? So it's almost kind of like refreshing when they go to a place where actually they want to spend time with the patient and get to listen to the story of what's happening so they can basically get a better feel for, hey, what are the body parts I should check to get the right diagnosis, or as you call it, the root cause of the problem, right?
Yep.
And I think that's so important, from a healthcare provider standpoint as well, not just from a patient standpoint.
Yeah, for sure. And all the people that I've sent to you have said the same thing. They appreciate that your appointment times are, full. You spend all that time with them. It's not like you're just seeing 5 other people at one time. You just hand them a list of exercises. All right, here, do these exercises. See you later. But so everyone that I've sent to you has really been impressed, and that's why I send them to you, because I know how you practice. But yeah,
that's awesome. So, what's your thoughts on getting physiotherapy combined with rehab chiro?
I think it's awesome. I think it's really valuable. I think there are two. It's like the yin and the yang, right? They complement each other. So I think there's a lot of. I think the way you and I evaluate people is pretty similar, but then we use slightly different strategies to attack that problem. But I probably do more manual therapy and less therapeutic exercise, and you I think do more therapeutic exercise and a little bit less manual therapy. But we both do both of those things. But I think that's really important because at different stages in the injury process, that's what people need. After they're initially hurt, sometimes they need a little bit more manual therapy, but then once they're starting to feel better, all right, now they need to start doing more exercise and getting stronger again, because that's what's going to help prevent the injury from coming back. So that's one of the things with chiropractic. The complaints that people have is like, oh, well, you go see this chiropractor and then you have to go back forever because you never fix the issue. It's like, well, that's only if they don't like address the strength issue, the stability issue, whatever mechanics or form that they have that's faulty. If people can strengthen their body, the risk of injury plummets. So strength is so important for injury prevention. So that's why I think that both the rehab chiro and PT work really well together.
Yeah, for sure. Yeah, one of the big things we talk about with our patients also is addressing habits, right? Because a lot of times it's not like, people get hit by a car and now in an office. People usually have pain for some time and now they end up in an office. So it's going to take a little time to unravel all the things that led up to this point. And a lot of times it's lifestyle, nutrition, habits, right? The way they move.
Yep.
strengthening, right? Kind of like we just talking about. So yeah, that definitely brings up a great point. So if there's one main thing you want to be known for, what would it be, Dr. Brackney?
One main thing that I want to be known for, man, I guess from a professional standpoint, it would just be one of the things that gets me really excited, and this doesn't always happen, but when someone comes to me and they're hopeless, they've been told by maybe their primary care doctor that, oh, you can't run again, you're not gonna be able to run again, you're not gonna be able to do XYZ activity again. And maybe they've even seen a chiropractor and that hasn't really helped. So they come to me as like a last resort, and I'm be like, and I can help them, get back to that activity. So, providing hope in somewhat hopeless situations. And it's super common kind of in our realm, like how many times have you come in or have you seen someone and I think it's a rotator cuff tear, and then the look on their face, you just sucked the life out of them basically, because in their mind, rotator cuff tear means they have to get surgery,
Right.
And they probably will never be able to do certain activities again. And it's just not true. I mean, sometimes that's true. Sometimes people need surgery from rotator cuff tears, but I'd say the vast majority of rotator cuff tears can heal on their own with the right therapy. Especially now that, the past maybe 20 or so years where regenerative treatments are now becoming more common, PRP, for example. Those things can really help those issues. And there's tons of different injury examples like that, where if you tell someone they have a disc herniation, they think that in their mind, automatically they need surgery and they'll never be able to run around ever again. And it's just not true. People's bodies can heal if you give it the right therapy. And like you mentioned earlier, address lifestyle factors, posture, nutrition sometimes. So all that stuff's important. But so anyway, back to the original question. Like I guess I'd like to be known for even if I myself can't help them, but giving them hope that their body can actually heal. You can do the activities you want to do again. So yeah.
Cool. No, I think that's awesome. That's actually, something I can definitely resonate with, because we see a lot of patients who have chronic issues. So by the time they come see us, they have been to multiple providers where they've been on the meds, injections. Sometimes they've been through multiple surgeries trying to avoid another one, or, they've been told they need surgery for the very first time and they're scared to bits about getting it because their friends got the same one and it didn't work out well for them. So just giving people hope and, educating them, like, hey, I can't guarantee that we might be able to avoid surgery, but we're going to do our best to see if we can put this off altogether and get you back to those activities that you enjoy. So I definitely deeply resonate with what your statement was just right now. And, like you said, regenerative therapy is a big thing, in the last 10, 20 years, and it's only gaining more momentum. And I think people are doing more research of hey, what are some alternatives outside of the traditional, medications, injections, or surgery. So that's definitely going to be I think a game changer in the next 10, 20 years from now too, where people are finding more about it and seeing the research behind it.
Yep. I agree.
Cool. So how can people get in touch with you, Dr. Brackney?
They can chat. I'm on social media, Instagram, Dr. Matthew Brackney. Also our website is a good way. My website's fixmysportsinjury.com. So those are probably the best ways. I could give my phone number too as well, if that helps. It's on the website though, but yeah.
All right. Sounds good. Do you have any promotions you want to promote, like any consultations, any upcoming talks?
I don't have any upcoming talks at the moment. But yeah, if anyone that watches this video from your crew, I'd be happy to give a complimentary initial evaluation too. So if they're having an issue and they want a Rehab Chiro's perspective, any of your people that watch this video and want to take me up on a complimentary initial evaluation, I'd be happy to do that.
All right, that's awesome. Thank you, sir, for doing that. How do they redeem that? Do I have to have a special code word, or just call and say, hey, I saw the video you did with Dr. Wong from Next Level?
Yeah, just have them say that they saw the video with Dr. Wong.
Okay.
That works.
Awesome. I'll definitely share that with my tribe, and then let them know that, hey, you know, got a great colleague, Dr. Brackney, around the corner from us. If you want to get checked out with a Rehab Chiro to see how he's different from all the traditional chiropractic and how it might help your situation, just give him a ring and get that comped evaluation set up.
Okay, awesome.
Cool.
Cool. Thank you, Dr. Wong.
Yeah, for sure.